Good morning once again, Upstate. Welcome back to today's show. I have two gentlemen in the studio with me this morning. They're both with the South Carolina Cancer Alliance. Mr. Henry Well is the executive director, and Mr. Johnny Payne is the co-chair of the Prostate Cancer Work Group. How are you both this morning?
Good, thank you.
Good morning.
Good morning. Henry, can you tell us a little bit about the South Carolina Cancer Alliance?
Yes, we're actually a statewide organization that's made up of 800 members from hospitals, health departments, lay volunteers, survivors, the faith-based community, and we are actually responsible for implementing the official state cancer plan. So our 800 members are kind of divided up into various work groups. And the one that we're going to actually talk about today with Mr. Payne is our prostate cancer work group.
Okay, so the Cancer Alliance, I guess you guys get all the research and the
Yes.
facts and figures and numbers about how cancer is affecting us across the state.
Yes, we
Okay.
actually work with DHEC and the Cancer Registry, and we look at the cancer stats and where the burden is higher and gear our programs for that location.
Okay, and as you mentioned, September is Prostate Cancer Awareness Month, and you're here, as I said, with Mr. Johnny Payne. Johnny is a huge advocate for prostate cancer awareness, working with us too as well. Talk to us about how prostate cancer is affecting men here in South Carolina.
Yeah, 3,000 men in South Carolina are diagnosed with prostate cancer each year, and 480 men die from this disease. And prostate cancer actually affects African American men more than Caucasian men. So one thing that we are doing at the Alliance is working with Mr. Payne and his work group to implement a series of educational classes. And the purpose is to teach men about prostate cancer screening, the digital rectal exam, prostate cancer, blood test, and so we can kind of empower them with the tools to talk to their doctor and make an informed decision.
Wow. Well, I know that, speaking to you and Mr. Payne, I know that prostate cancer is something that, if caught early, is quite manageable, correct?
You are correct. And prostate cancer, it can be a very slow-growing disease. That's why it's so important for men to talk to their doctors and make the best decision concerning their type of prostate cancer.
Okay. And you said before that prostate cancer affects African American men at a higher rate. Do we know why this is? Because it's that way in so many different illnesses and diseases.
We don't really know. We have some things, reasons we think it might be. Of course, it's a genetic disease, and we know African Americans, we have a high incident rates within our family. Prostate cancer is a disease. One of the risk factors is hereditary. So even with white men with first degree relatives with prostate cancer, they're more at risk. We think diet may be an issue. We think maybe exercise could be an issue. And also awareness is an issue. Black men, for whatever reason, we don't seem to get screened as early and as often as white men.
Wow. Okay. So the key is being proactive about your health, as we talk about so often. And so I know that there's been some discussion about when men should start getting their prostate cancer exams. Correct, Johnny?
That is correct. And that all depends on who you ask. Now, we have certain guidelines through the South Carolina Cancer Alliance. The ACS has guidelines. The UAU, the American Urology Association, they have certain guidelines. But generally, we're saying for black men age 40, and also for men with a family history. And if you're a white man with a family history, like I mentioned, age 40. For others, maybe age 50 would be a good time to start. And the main thing when you start, we want you to establish what we call a baseline. Get that first initial reading and then track it every year or every 2 years, depending on what the reading indicates when your next follow-up should be.
Okay. And we know that the case with so many men is that they just do not go to the doctor and get their regular checkups. Now, I'm sure there are men listening this morning saying, I go to my doctor, I get my regular checkup, and that's amazing. But there are so many men who just don't go to the doctor. I don't know, what that reasoning behind it is, but I think that
we ask ourselves
Right.
that question all the time. But I'm a man, and I was like that too. And Rhonda, I've shared this story with you many times. the way I discovered my prostate cancer, I wasn't going to the doctor at that time. But then I went to a health fair, and they were doing prostate cancer screenings, and I took advantage of it. And I found out, and I had a very aggressive tumor. And I really believe that if I had not done that at that time, we may not be sitting here talking today.
Wow, wow. And then, just kudos to you. We're thankful that you're here, and we're thankful for all the work that you do to spread awareness about prostate cancer. I'm sure there are so many men who have gone out and gotten their prostate cancer screening because they've heard you talk about it at different events and on the radio and everything like that. And it's all about spreading awareness. So we definitely want to encourage men. If you have a man in your life and you know that he's not going to the doctor, make that appointment for him and just go ahead and take him out. Maybe take him to lunch first and then swing by the doctor's office and do it that way. But we definitely want to make sure that our men in the upstate and nationwide are getting their test. Because as we said earlier, if detected early, prostate cancer is very, very manageable. Now, if you don't have a regular doctor, of course, we want to encourage you to get a regular doctor. However, there are often events across the upstate where you can go and get screened for prostate cancer for free. And what you can do is you can reach out to the Cancer Alliance to see if there is anything on the schedule. You can call Mr. Well directly at 803-708-4732. You can also contact us to Prostate Cancer Alliance Group. And what would that number be, Johnny?
864-616-0923.
Awesome. Now, I know coming up at the beginning of October, there are two great events where you can come out and get prostate cancer information. They're events that's being hosted by the South Carolina Cancer Alliance, and they are actually seeking out African-American men to hold discussions about prostate health. And those men should be aged 40 years of age or older. Talk about these events, Johnny. I know the first one is on Thursday, October 6th. The second one is on Saturday, October 8th, and they'll be held at the community room at the Gibbs Cancer Center on Highway 14 in Greer.
Okay, I sure will. Rhonda, the South Carolina Cancer Alliance Prostate Cancer Work Group was fortunate enough to secure some funding to do a implementation project to increase prostate cancer education and awareness here in the state of South Carolina. So we're in the midst of this project. I'll go through a couple of things the project did entail. First, it entailed us sending out a survey to healthcare providers throughout the state of South Carolina. The purpose of this survey was to get an understanding of the relationship healthcare providers had with African American men as far as prostate cancer concerned. The second part of that project is to get a group of African American men in and discuss prostate cancer education and awareness. We'll go over signs and symptoms, risk factors, treatment options, and those type things. Now, we're having two educational sessions coming up in October. The first will be October 6th, and it's going to be at the community room at the Gibbs Cancer Center in Greer, South Carolina, off Highway 14. And then we're going to have another similar meeting, in fact, the same meeting, on October 8th. So what we're asking folks to do is choose the meeting that works best for your schedule. And then we're going to have a final follow-up meeting in November 12th, and this will consist of the same men that attended either of these two sessions, and the healthcare providers that we surveyed. And we're hoping to get everybody there for one final educational session. And for the men that we come, we are paying an incentive. You can get $20 for the first session and then $25 for the session that's going to be November 12th. You must register for this, and we'll be sending out information, and Rhonda will give you the number and the website that you call to register for. And we're really looking forward to seeing you there. And this is for African-American men age 40 and above. Because this is the age that we feel are most at risk for prostate cancer.
Wow. So there's an incentive for you. We want to know how to get men out to get more information about being proactive about their health. If you attend the session, which the session, of course, is completely free, you get $20 for attending the first session and another $25 after you attend the informational community forum on prostate health. You can sign up by calling 803-708-4732. You can also log on to the South Carolina Cancer Alliance website at www.sccancer.org, www.sccancer.org. The whole idea is to help men be more proactive about taking control of their health. Prostate cancer is something that, if detected early, and even Johnny said his when his prostate cancer was detected, it was advanced. Was it, Johnny?
Well, it wasn't advanced, but I did have a high PSA.
Okay, but you went and you got it taken care of, and
Right.
you've been in remission since
Yeah, 15 years.
for 15 years. Awesome. So it's not something that you want to, put off and keep putting off. Go to the doctor, get your prostate cancer screening, attend these informational sessions Thursday, October 6th at 6 p.m., Saturday, October 8th at 10 a.m. They're both in the community room at Gibbs Cancer Center, 2759 South Highway 14 in Greer. If you attend one of those sessions, you get an incentive of $20, and then attend the final community forum Saturday, November 12th at 10 a.m. at the Fellowship Greenville Church, Highway 14 in Greenville, South Carolina. When you attend that, you'll receive another $25. So we want to encourage you to come out. Once again, for more info, call 803-708-4732. Thank you both so much for coming in this morning.
Thank you.
Thank you for having us, Rhonda.